Okay, so welcome everybody to our third webinar of our series of 3. I'm Morgan Knull with Feed Your Genes, and I'm joined today with Dr. Penny Kendall-Reed, the creator of GeneRx.ca, our integrated genetic platform. Today we're going to talk about detoxification, and then I'm going to get into a little bit of the food side of things. So Dr. Penny, I'd like to ask you to get started and we'll go from there.
You bet. Thank you everybody for joining us and for listening afterwards. This is a really important topic. It is certainly, it's one that has literally saved my life. So I'm really excited about it. To me, the pillars of health, they revolve certainly around diet and exercise, but also sleep, stress management, and detoxification, all of which include inflammation in all of those variables. So I'm really thrilled that we're ending our webinar series with this really crucial component. And as NDs, we have always appreciated the importance of detoxification, but so many in the medical communities have always thought that we used to use it as a weight loss trick, just by drinking juices or avoiding certain foods. But over the past decade, research has really proven those antiquated ideas in a different manner. So what's really going on in our environment today? Well, pollutants. A scary study showed that in 2015 alone, the chemical pollutants in the US waters resulted in more than 100,000 cases of cancer, just cancer alone. And that's only in 1 year. Similarly, our air is now so carcinogenic that in 2013, those pollutants caused 223,000 cases of fatal lung cancer worldwide. And that's just lung cancer. That doesn't include all of the other cancers. In one study that was put out by the Environmental Working Group, assessed over 210 toxins or contaminants in volunteers. And it's worth noting that these volunteers did not work in factories or farms where the toxic exposure was much, much greater. And what they found was that at any given time, in any given individual, 91% of those toxins were present in them. And the toxins that they found inside them, the 53 components of those were linked to cancer. 62 components were linked to CNS and brain disorder. 8 linked to endocrine system disorders, and 55 of them toxic to the immune system. So that's really significant. So let's take a look at how this applies to genetics. Well, there's a fabulous study of mothers who were exposed to low levels of arsenic in their drinking water during pregnancies. Researchers then examined the DNA methylation patterns in cord blood cells from the offspring, particularly focusing on the genes that were involved in growth and development. And what they found was significant alterations in those rates of methylation. And that led to alterations in the phenotypic symptoms such as low birth weight, smaller head circumference, and lower placenta weight. They then took this study one step further, and they compared those genes with phase 2 detoxification genes, so the ability to clear out arsenic or not. And what they found was astonishing, but yet I guess not that astonishing when we look into genetics. Those who had SNPs at their phase 2 gene, larger alterations in methylation rates, and that led to more significant phenotypic changes, meaning those children had even lower birth weights, lower head circumferences, etc. So phase 1 detoxification and genetics. We know that phase 1 detoxification involves the alteration of toxins by cytochrome P450 enzymes to prepare that toxin to be eliminated by phase 2 substrates. SNPs of these genes can either increase or decrease the production of those cytochrome P450 enzymes. And these are the genes that where being homozygote normal is actually not the ideal place. The Goldilocks position for this is heterozygote, because increased expression causes an overproduction of phase 1 substrates, which actually increases inflammation and precancerous substrates, whereas decreased expression causes an abundant buildup of the intracellular toxins, and that also leads to an inflammation, so just through different routes. Phase 2 detoxification and genetics. Here, phase 2 detoxification then binds to those phase 1 substrates to help clear them out. And most of this is governed by glutathione or glutathione pathways. SNPs here that adversely affect phase 2 detoxification will decrease glutathione or increase reactive oxygen species production or decrease NRF2 pathways. All of those will lead to a decrease in the removal of those phase 1 substrates, those toxins, xenobiotics, those hormones. And all of that's going to increase inflammation, which then we know inflammation, just like cortisol, has a great ability to then alter the expression of pretty much any other gene, just as we saw in the previous study with methylation and head circumference. So the genes that we're going to look at today are this list here. And we're going to start off with probably one of the most misunderstood genes that are out there in the phase 1 detoxification realm. And that's CYP1A2. The normal allele is A and the variant is C. But here I use those words normal and variant again loosely because both alleles come with their issues. And hence the heterozygote position is what I call that Goldilocks position, the best position here. These cytochrome P450 enzymes, along with the next gene that we're about to see, metabolize over 90% of medications. And people keep thinking that this gene is just about coffee. And yes, it does. It guides how many coffees per day are beneficial or detrimental, but it also clears out all of those pharmaceuticals as well as most xenobiotics and is key in the metabolism of 2-hydroxyestrogen, the good estrogen. CYP1A2, the A allele, the normal allele, has increased production of these enzymes, making them a really fast metabolizer. So this means that they can increase the carcinogenic polycyclic aromatic hydrocarbons. Those are those chemicals that are released when we burn tobacco or wood or even barbecuing. It also increases the activation of aromatic amines, which are the byproducts in plastics or industrial cleaners, and heterocyclic amines, which are produced when we cook meat or fish, but mostly fish. So, a lot of these are common substrates that it acts upon. All of this greatly increases cancer, especially bladder and breast. But one good side of the A allele here is that it encourages the production of 2-hydroxyestrogen, the beneficial kind. So you can see from one point of view, it helps to reduce breast cancer, pushing the 2-hydroxy, but you can also see that it increases breast cancer and other cancers by activating those carcinogenic substrates at a much faster rate. Whereas the C allele, the variant allele, produces far less enzyme and thus produces less phase 1 substrates, but to the point where the body actually can't get the toxin outside of the cell. This in turn increases tumor necrosis factor and other inflammatory cytokines. In addition, the body actually can't remove the toxins, particularly in the cardiovascular system, and this increases the risk of cardiovascular disease and heart attacks, as well as colon cancer and polyps. Another downside, though, to this allele is that it inhibits the formation of that good 2-hydroxyestrogen. So this again increases the risk of breast cancer. So you can see that they both have cancer risks, but they're coming from different areas. And so to decrease those risks, you have to treat them differently. So how do we support these alleles? Well, certainly for the A allele, we want to slow down the production of this enzyme. And caffeine is a great slower downer of CYP-A allele. So 2 to 3 cups of coffee a day is ideal for them. And in fact, it'll reduce the risk of having infarction by 68%. Curcumin, also another fantastic way to slow this down. For the A allele, curcumin is anti-inflammatory. But what will speed it up? Raw cruciferous vegetables. So that typical detoxification of juicing raw vegetables will increase inflammation for the CYP1A2 A allele carrier. These guys, we need to cook all of those cruciferous vegetables. All of the other non-cruciferous vegetables, the cucumbers and peppers, etc., they can all be eaten raw. It's just the cruciferous. Milk thistle, mint, and echinacea will also do the same thing. So those are also substrates that the A allele needs to avoid. Whereas C allele, they need to avoid the caffeine for sure. They need to avoid acetaminophen or Tylenol. I didn't put that in as a way to help slow down the A allele because I certainly don't want someone taking Tylenol just as a way to slow this gene down. Definitely have to avoid curcumin. And this is really important because curcumin, again, amazing anti-inflammatory, but it's in so many of our fantastic products. So this is a place where you need to look at how they code here and really decrease the overall amount coming in. Here we want to do the juicing or increasing those raw cruciferous vegetables. And because what we're getting out of them is the DIM, which has a superior impact on this gene. We also want to increase the calcium D-glucarate, which increases the removal of the hormones, estrogen particularly in this case, by glucuronidation. And we have HMR, those lignans that increase organ cellular support. And then finally, milk thistle, as we know, for liver. CYP3A4, our next major phase 1. Here the normal allele is C on 23andMe, but in a lot of studies it's G, so I always put in quotes, both versions, just in case, so that you don't get confused. And the variant is T, or in some studies it's A. This gene is the second most abundant cytochrome P450 enzyme producer. It's in highest concentrations in the liver and small intestines next to CYP1A2, but it's also highly abundant in the breast, prostate, stomach, and colon. This gene metabolizes up to 50% of our medications, and it's a really large catalytic gene in the production and activation of estrogens and testosterone. And it also detoxifies bile acids, so clearly a really important gene here. The C allele, or the normal allele, like the 1A2, has increased production of enzymes, leading to more phase 1 substrates. So this can, just as we saw before, increase the risk of cancers, particularly in the breast and the prostate. This gene, though, really favors 16-hydroxy and 4-hydroxy production over 2, particularly the 16-hydroxy, but it will also push to the 4. So this time, the fast allele is opposite to CYP1A2 in terms of its protection from breast cancer and prostate from an estrogenic point of view. Allele from the 1A2 help push towards 2-hydroxy. Now the fast allele pushes away from it. The T allele has decreased enzymatic production, so much slower clearance of those toxins again. And those toxins, as we saw before, increase inflammation in some cancers, but more so in the tissues where this gene really resides, so the colon, the breast, and the prostate. But it also increases the 2-hydroxy estrogen away from the 16. So again, opposite here to the CYP1A2 again. So that helps to decrease the direct hormonal effect from cancers. So once again, supporting these two genes from different sides, we want to use the same tools to slow it down. We're going to use that caffeine to slow it down. We're going to use curcumin to slow it down. We're going to cook the vegetables. But this time we're also going to add in a biannual detox, which involves slightly slowing down the phase 1, but really aggressively upping the phase 2 pathways. And support for the T allele, the variant, again, very similar to what we saw with the 1A2, but this time rather than just biannual, we're actually going to put in quarterly detoxes, increasing both phase 1 and phase 2. And it's important to note, when I say here detox, I don't mean our old detox kits that we used to have, just throw every sort of liver herb at that, which really stimulated mostly phase 1. Here, it's really about upping that too with a mild phase 1 support here. GSTP1, this is one of our first phase 2 detoxification enzymes. This glutathione S-transferase P, that's the phase 2 enzyme that binds and clears out most toxic compounds, including carcinogens, estrogens, and cytotoxic medications. This gene's in almost every cell in the body, and that's why it is so critical. The only place that you're not going to find it is in red blood cells. But it's in highest concentration in lungs and breasts. The A allele is the normal allele, and this time, this is a good allele, so we don't have the Goldilocks position being heterozygote here. It has the highest glutathione enzyme production, and thus the highest clearance of toxins naturally. However, oddly so, it'll increase the production of interleukin-6, thus increasing inflammation, when you supplement with vitamin E, particularly when increasing vitamin E over 75 IUs per day. And really important to note that this is independent or almost even worse in those who code poorly for their vitamin E genes where you actually want to supplement them with vitamin E, you can't here. So unfortunately, what wins between the vitamin E and the glutathione, hands down, the glutathione always. The G allele, on the other hand, has a very low production of enzyme and thus low glutathione activity, increasing the risk of breast cancer significantly. In fact, GGs are 0.73 times more likely, or 1.4 odds ratio of developing breast cancer. That's a huge risk factor there. And that risk decreases, though, if they do consume a high amount of cruciferous vegetables. because the isothiocyanates are spared the rapid metabolism and they actually increase the phase 2 clearance. Interestingly, they also have a lower risk of chemoresistance with doxorubicin, a chemomed that slows and stops the growth of cancer cells. However, GGs, because they can't clear out toxins well, particularly in the lungs, they have a really high risk of allergies and asthma. So support for the normal A allele really is just about avoiding those high doses of vitamin E. But it's important to note that even though one may be AA, so completely normal, our bodies aren't used to the incredible amount of toxins that we have in our environment, as seen by those stats at the start of the lecture. So boosting support here, if they live in a big city like I do, or travel to polluted areas, not that we're traveling right now, but once we start getting there again, is still really useful. And support for the G allele includes all of our great nutrients and supplements that we know for glutathione. So directly liposomal glutathione, NAC, its precursor, and then all of our cruciferous vegetables because of the D, and vitamin E with the variant allele here alone. Our next gene is SOD2. The normal allele is A or C on some studies. The variant is G or T on some studies. Superoxide dismutase 2 is the enzyme that converts superoxide and ROS, or reactive oxygen species, to their inflammatory and damaging molecules into less damaging forms, the hydrogen peroxide and the diatomic oxygen, in order to protect the mitochondria and the DNA. This enzyme becomes more valuable as we age, also during cancer, during any inflammatory state, and also during motor neuron diseases. The G or the T, which is the variant allele, has a lower production of SOD2 and thus a decreased clearance of reactive oxygen species, greatly increasing overall inflammation. The inflammation response is actually so great that GGs have a 10-fold increased risk of cardiomyopathy, because we know how important the mitochondria are for this. And as increased reactive oxygen species in the myocardium causes ischemic or reperfusion injury. So there's also a really significant increase in cancer, especially in the lungs, also with non-Hodgkin's lymphoma and colorectal cancer. And of course, as SOD2 is so prominent in the mitochondria, we see great decreased energy levels in these people. So a lot of the sort of chronic fatigue syndrome, fibromyalgia-like syndromes. Support for the normal allele can still take place, particularly in high-level athletes that generate so many more ROS through exercise. So they may need, particularly again, if they're exercising outside and exercising in a city, they still may need a little bit of support. And the support that we're going to use is what we would use for the G or the T allele. And these are our good old super nutrients that we know. So again, the DIM and the sulforaphanes, but one of my favorites is the astaxanthin here. Certainly glutathione and NAC. We know all of those will greatly increase SOD activity. On its own, astaxanthin there is probably one of the strongest ones to increase SOD activity. But glutathione, because it's also a scavenger of hydrogen peroxide that partitions between the mitochondria and the cytosol, we have one more extra benefit if we go the glutathione NAC route in order to support the SOD2 over the astaxanthin. And that's just one way of sort of doing a double duty with glutathione and NAC for our patients with less number of pills. Finally, we have NQO1. The normal allele is G or T, and the variant is A or T. G or C, and the variant is A or T. This gene produces the enzyme NADPQ quinone hydrogenase 1, which is the main enzyme that stimulates all the NRF2 pathways. So these pathways inhibit redox reactions, those transfer of electrons of quinones, to stop or slow the production of ROS. Quinones are those biologically active compounds that are needed to produce ATP, but if they're not fully oxidized, then they start to produce ROS. So the NQO1 enzymes ensure that all of those partially oxidized quinones get targeted. These enzymes also bind to toxins such as household cleaners, pesticides, and cigarette smoke, as well as estrogens, and help clear those out. The variant allele A has a lower enzyme production, leading to increased inflammation and ROS. Clearly, there's a decreased clearance of toxins that has been shown to increase the risk of multiple myeloma by 7-fold, as well as increasing breast, lung, and colon cancer. This allele is also not responsive to epirubicin, which is a popular chemo drug. Expression of this allele is greatly increased, so we can support that A allele which is lower through high-intensity interval training. But you gotta go back to that exercise component, that exercise lecture that we spoke about, and take a look and see if you're actually designed for HIT. So here, if you're designed for HIT, this is a great way to increase NQO1 expression. If you are not designed for HIT, it's actually gonna lower your NQO, so you need to be careful of that. And then again, using our DIM, sulforaphanes, resveratrol, glutathione, and NAC. We can see there's so much crossover, and we can really hone down and target phase 2 detoxification. My 2 standard go-tos, apart from using some of the great, DIM and sulforaphanes that through diet that Morgan's going to be talking about, but my 2 go-tos here will be always the glutathione and NAC, because we're going to do double duty. So let's take a look at how, again, different genes are going to completely shift what we're doing with our patients. So our first one is Mary. She's a 44-year-old runner, and she always feels like she's breaking down. She has increased joint inflammation, often with a skin rash on her chest, and a lot of abdominal bloating and discomfort, particularly after a long run. She started taking Tylenol after hard workouts to help deal with the inflammation and the pain, and curcumin every day, because that's what everybody thinks that they should do, but she started getting worse. She has no known allergies. She lives and runs in downtown Toronto. She's always eaten a very clean diet, rich in cruciferous vegetables, but she always cooked them because she thought it was going to make her bloating worse. So when we look at her genes, her CYP1A2 has the slowest production of phase 1 substrates, and thus clearance outside of the cells of those toxins. And this is made even worse by the curcumin and Tylenol that she was taking. She also has slower activity through her 3A4. Her phase 2 detoxification is very weak, being variant for GSTP1 and SAW2, and heterozygote for NQO1. So all of the inflammation that she is generating from these above genes is then further inflamed because her interleukin-6 gene is also variant. And so what that's going to do is when she starts exercising, it's going to pump up that interleukin-6, which is then going to further tip off inflammation through all of her other genes. And again, she was making things worse with the Tylenol and the curcumin. All of this inflammation started to stimulate the mast cells in her GI tract and in her skin, and hence she was getting the bloating and the rashes. And although she was great with her cruciferous vegetables, she was cooking them when she really needed to eat them raw. So what did we do with her? We took her off of the curcumin and the Tylenol right away. We increased her raw cruciferous vegetables. I was using a greens powder there for 6 weeks just to really sort of ramp it up. We used the glutathione and the NAC to help clear out and reset those phase 2 detoxification genes. We used a quercetin bromelain only for 8 weeks to target those mast cells that were being triggered in her skin by the interleukin-6, and used a DIM sulforaphane resveratrol type combo. 2 capsules twice a day, again, just to support both the phase 1 and phase 2 detoxification. Within 2 weeks, her inflammatory response was 50% better. Anything that's in quotes is their term. Her breathing greatly improved, although she didn't know it was poor until she felt better. Whenever there's mast cells that are activated anywhere in the body, and hers were in the skin, you're going to activate them in the bronchi as well, and you're going to activate them in the GI tract, and she was getting that. Her rash post-runs disappeared after 4 weeks. Her joints felt much better. She said they felt younger, but her bloating remained, and all of her symptoms were better if she ran indoors. So we continued her on the DIM combo, the DIM and Detox, for another 4 weeks. And then 7 weeks into the program, just took a little bit longer to get rid of that bloating. All of her symptoms were 90% better. 3 years later, all of her inflammatory responses remained normal unless there was apparent causal factors such as a cold or a flu. She rotated in the DIM combo 1 week out of every 3 months to keep supporting those detoxification genes. We increased her glutathione and NAC to 2 twice a day when she was running outside on humid days or in a highly polluted area, or just doing a really, really long run that generates a lot of those ROS. And we used Boswellia if she felt that she needed any extra joint support. But other than that, she was great the entire time and still is. Julie's also 44, and she's actually Mary's running partner. She has a family history of osteoarthritis, but she herself has absolutely no symptoms. She's taking curcumin preventatively every day because her mother was doing that for her arthritis, and Julie didn't ever want to get into that arthritic state. She does the exact same exercise regime as Mary because they do it together, but her diet is not nearly as clean as Mary's. She eats a lot of fried foods. She drinks 4 cups of coffee a day. And she puts in certainly some dairy and a tiny bit of sugar in those coffees. But when we look at her genes, we see why Julie is actually okay compared to Mary, because she produces far more phase 1 enzymes that actually need to be slowed. So she was doing a great job of slowing those down with her coffee and the curcumin. Her clearance of toxins through her GSTP1 gene was normal, unlike Mary, even though her SOD and NQ were identical to Mary's. But because she had a normal interleukin-6 gene, when she exercised, she didn't trigger off as much inflammation to then trigger at the SOD and the NQ01 gene. And it was also moderated again, decreased inflammation by her GSTP1 gene. So her combo pattern and substrates was really helping her. So for her, we kept her on the curcumin, just actually moved it to empty stomach because she was taking it with food. And when we take curcumin with food, the absorption to outside of the bowel is not nearly as great. Put her on some just straight astaxanthin to help support that SOD2 gene, just 1 capsule twice a day. 4 coffees was a tiny bit too much, so we reduced her to 3 and increased her cruciferous vegetables, but we had her cooking them. So we can see that these 2 women had very, not too dissimilar genes, but only 1 or 2 of them were different, but how different that translates into their symptoms and how different it translates into what we are to do with those symptoms and how we're to treat them. And that's what makes such a big difference. So here we see Julie didn't have any of those symptoms. Her osteoarthritis family history came actually through her MMP3, which is the gene that increases an enzyme which breaks down collagen, and COL1A1, which is a gene that repairs collagen. So because she was actually heterozygote for those, we increased using some resveratrol and hydrolyzed collagen as well. And 3 years later, just as Mary was, she is feeling fantastic, and she's still doing the same workouts with Mary, and also protecting her osteoarthritic family history at the same time. So I welcome any questions at this point before I hand over the screen to Morgan.
Thank you, Dr. Penny. And if there's any questions, you can type it in the webinar chat space. Someone has a hand up. Okay. Go ahead and ask your question. Oh, unmute. Hold on a second.
Could they type it in?
Yeah, I don't think it's working. Dr. Bean, can you type in your question into the webinar chat? And while you're doing that, Dr. Penny, I had someone text me a question just about the detoxes that you talked about that could be done twice a year or quarterly. What type of detox and what you're recommending for those?
So those, again, I get very specific. Like I don't have a kit for it because it really is dependent on their genes. But the biggest variable that we need to do here for them is all about slowing down the phase 1 if they need to, and really, really upping the phase 2 detoxification. So normally if I'm going to give a patient with those genes that we saw, 1 capsule of NAC and liposomal glutathione twice a day for 8 weeks, and then I drop it down to once a day as a maintenance, then what I'm actually going to do is double that during the detoxification. So I'll have patients take 2 glutathione and 2 NAC twice a day. If they need to slow down their phase 1 and they're only on 1 curcumin a day, I'm going to double it to 2. If they're on 2 a day, I'm going to double it to 4. So it's really taking what their genetic pattern is to help reset those genes, and then doubling that dose to really push those detox pathways.
Okay, that sounds good. We do have another question coming in, and give me a minute to type it out. Of course, we will come back to that question right at the end of this next presentation, where we can answer questions on both at that time. So, Dr. Penny, can you see my screen all right?
Absolutely perfect.
Perfect. So I'm going to just talk a little bit more about the nutrition side of things to reinforce what Dr. Penny's taught us about the phase 1 and phase 2 detoxification SNPs. So for phase 1, how does the body handle cigarette smoke, caffeine, peppermint, echinacea? Let's say someone's normal variant for that, and we want to slow them down a bit. How can we do this? Well, just like Dr. Penny said, we can use caffeine. So some people require 2 to 3 cups per day to slow down the activity. We can also use herbs like turmeric and curcumin in things like our smoothies, cooking, and our supplementation. These people can enjoy the charcoal meat, so barbecue can be for dinner. And of course, these are all things that we want to stay away from if someone is heterozygote or variant positioned. So let's say if you're someone like me and you are very slow, you're homozygote variant or you're heterozygote, and you want to speed this phase 1 detoxification up, my favorite thing to recommend is peppermint tea, mostly because it's so simple and many people can add it into some point throughout their day. I typically, when I'm creating a meal plan for someone, I'll put it into their afternoon snack so that they remember to have their peppermint tea. You can use fresh peppermint, you can grow yourself, or you can get dried peppermint tea. It's just one of those easy things that goes a long way. So I really love recommending it for people with a slow detoxification there. We can also use supplements and tinctures with echinacea. As Dr. Penny said, definitely raw cruciferous vegetables are going to be most beneficial. Now, for people who are slow with their phase 1 detoxification, we want to avoid caffeine, no more than 1 cup a day, those charcoaled foods, and the turmeric and curcumin. And we do want to check the supplements because so many of the supplements do include those ingredients as they're so popular. And just one note about the caffeine. So in my case, I had come to Dr. Penny and said, you know, I'm variant for this position, but I really love my 2 cups of coffee a day. And, you know, Dr. Penny said to me, I know you're having your peppermint tea. I know you're on your glutathione and your NAC. You eat so much cruciferous vegetables. In that case, I'm not too worried about it. So with this, you know, do remember to look at the person in front of you and to take into consideration all of the things that they're doing to support their detoxification if there's something that they really want to have that second cup every couple of days or when they want it. So for your phase 2 detoxification, how we're clearing there, are we converting to glutathione? So this is a big one when I have talked to practitioners who are using NAC with their patient population. And it's so important to be able to check these SNPs because that NAC isn't going to go as far as you want it to if the people are not able to convert it into glutathione. So in that case, you really want to take both of them together. So when phase 2 is too slow, we can see issues with inflammation, cellular damage, and the way we can speed this up is through our supplements and through our cruciferous vegetables. And like we said, phase 1 is going to determine whether those vegetables should be raw or if they should be cooked for best support. So when I'm creating a custom meal plan for someone based on their genetics, as we've talked about before, I'm really clear about how many meals, if they can snack, what their protein is per day, but often I'm putting cruciferous vegetables in there and whether they should be cooked or not. And I find that this helps, you know, with telling people, okay, so if you're having a stir fry, maybe at the end throw in some raw broccoli, or put some cauliflower rice that hasn't been cooked into a salad and use it more as like a cheese topping or something like that. So just giving them examples on how they can work that into their diet, I find is very helpful. So raw versus cooked. The examples I'm giving to people for raw is, use your salads, create your deli boxes for your lunches, and add raw to any cooked dishes. And smoothies or raw juices are great. When someone requires cooked, I'm giving them suggestions through warm salads, roasted vegetables, mashed. Everyone knows I'm a huge fan of mashed cauliflower. I think I'm obsessed with it. You can saute them, as well as baking. There's so many opportunities to bake. I looked at a recipe the other day that was kind of a smoothie muffin, and we pureed broccoli and some kale, and then we turned it into muffins. So there's a lot of opportunities for people to very much enjoy both raw and cooked cruciferous vegetables. And as Dr. Penny shared before, all the other vegetables can still be enjoyed raw. So if you've joined this live webinar, and most people have registered because they're looking for the recording after, I know so many people are back to work this week. So we made sure that about 90% of you were getting the link after, but I'm also going to be sending you recipes for both raw and cruciferous vegetables. I just put a few together on each side, and that way if you have a client sitting in front of you and they're like, oh, I don't really have ideas for cooked broccoli or things like that, I just wanted to share something that you could then email or share with your clients. So for upcoming webinars, stay tuned. This wraps up 3 of our 3-part series, and we do have them all up on the YouTube channel. So whether you're wanting to review one of the webinars we've already done, or if you want to look into the GeneRx tutorial, I find that that's really helpful for people who haven't quite yet started editing their patient recommendations. Dr. Penny talks about how you can easily do that in the tutorial, as well as we've recorded several short interviews on different topics like detoxification or stress, sleep, snacking. And the reason that we did all of these was so that they were patient friendly. If you wanted to share them on your pages, it encourages, your patients to learn a little bit more about genetics, and, hopefully get interested to come and see you to discover what theirs are. And of course, I'm on Instagram at feed.your.genes. So that concludes that part. And now we're going to get to our questions, because I see we have some.
I also have one too, Morgan. Can you think of a way, do you remember that amazing recipe that you talked about for us with the bark made with the Designs for Health protein and the Greek yogurt and the Lily's chips?
Mm-hmm.
Or it doesn't work for me, but I'm thinking for patients, is there a way that you could make that into peppermint bark? Like, would you just cut up the peppermint and put it in, or how would you do that?
Absolutely. And making like a yogurt bark and freezing it is my favorite treat to make, because I use, like you said, I use the Designs for Health paleo protein, either the chocolate or the vanilla, and then I just add whatever I want to the bark. I lay it out, I freeze it, and then I break it all up and I eat it in snacks. But to your point, in that case, I would even do something like using the chocolate paleo protein and then adding a few drops of peppermint essential oil or peppermint flavoring to it to get like a mint chocolate chip sort of bark. And that's really good for your metabolic people as well, who are wanting something sweet or something to snack on after, to just go in the freezer, grab a piece of that, and they're not only supporting their metabolic SNPs, but also their detoxification SNPs. So great question there.
Fantastic. Thank you.
So we do have a question. I'll just read it here. So I have a patient I'm working with who has fast phase 1 genes, which are working to slow down. which we are working to slow down. She has multiple phase 2 variants, and we are doing glutathione with her, but she has a lot of chronic inflammation, Lyme, and multiple CO infections, and believes she has some sulfur-dominant SIBO. So then realized that many of the supplements she was taking contained sulfur and seemed to be making her worse. We are now treating the SIBO, but I feel like we are in a catch-22. She needs the glutathione, etc., but it's also flaring her up. Slowly trying to reintroduce it, but do you have any insight into how this all affecting her genes? Her inflammatory genes are wild type.
Okay, so great question here, and it is. Whenever there's SIBO, it's tough because the NAC glutathione or anything with the sulforaphanes is really going to aggravate the bowel. So where I go to there is using the astaxanthin so that we can help support all of the phase 2 detoxification there. If you have access to it, I would actually do IV glutathione because she really needs the glutathione to get that inflammatory response down. But then I would, then you sort of bypass the digestive tract so you don't get the inflammation in the bowel. The other thing is going to N-acetylglucosamine versus N-acetylcysteine. Now you're not going to target the glutathione here, but N-acetylglucosamine is one of the next to glutamine, one of my favorite villi rebuilders and quite specific for SIBO there outside of using the antibacterials. So I would use high dose astaxanthin, an IV glutathione if you can, and then stick in some N-acetylglucosamine.
That's great. Thank you so much, Dr. Penny, and great question. Thank you for that. Let's see, I don't see another question coming in at the moment. And so the other thing I wanted to share with everyone before we hop off here, and we're respectful of everyone's time, is the GeneRx.ca has had a big update, right, Dr. Penny?
Yes, it has. So it's got new genes, a whole thyroid panel section, and an entirely new look. You also have complete control over your account, so you can update anything on it. You can add your logo to the reports. You can add your name and your office address to the report if you want. You don't have to. You can put in any picture and then leave the address blank if you wish. But you can also manage your own account yourself now. So everything has a whole new look to it, new genes, and new things that you can add to it.
I also added my logo, and it just looks so incredibly professional. And a doctor was referring a patient to me the other day and attached a copy of the patient's GeneRx, and that doctor's logo was on it, and it looked totally different. It's just such a custom tool. So I'm thrilled about that, and I want to make sure everyone knows about that before we hop off. And really just thank you everyone for joining us. I'll be sending you an email shortly that has the recording of this for your review. And we know many people weren't able to make it live today because of getting back to work, which is a great thing. And I'm also going to send you those recipes. So keep your eyes open and stay in touch, and we'll let you know when our next webinar is. Dr. Penny, any last remarks?
No, I just want to thank everybody for joining, and hope everybody is staying well and also staying happy. These are hard times, which, as we know, stress increases inflammation and makes all of these worse. But it's a time that I hope that we can all find something good out of, and I look forward to a new future for everybody.
Oh, wonderful. Great sign off. Okay. Thanks everyone. Have a great day.
Have a great day.